Broadcast is now starting. All attendees are in listen-only mode.
Welcome. Thank you for joining us for the panel discussion on foster care and COVID-19, a call to action. For 27 years, Friends of the Children has been working with children and families impacted by the foster care system, empowering them to reach their full potential through relationships with professional mentors, 12 plus years, no matter what. If you'd like to learn more, please go to friendsofthechildren.org. Before we get started, Ariane Le Chevalier will share a few housekeeping tips with you.
Good morning. Please submit questions to today's presenters by typing them in the questions pane of the control panel, which you can submit throughout the call. You can also join the conversation on Twitter with the hashtags FosterOurFuture and National Foster Care Month. We also encourage you to use the panelists and organizations' Twitter handles, which will be listed throughout the discussion. Thank you.
Thanks, Ariane. I'm so pleased to be with all of you here today to share what's happening with youth in foster care as a result of the coronavirus pandemic and how we can take action. Typically, National Foster Care Month is a time to call attention to foster parents and those surrounding youth in foster care with support. Today, I'm hoping this discussion will focus on our youth in care. This has been an extraordinarily challenging time for the more than 430,000 children in foster care nationwide. More than 40% of youth in Friends of the Children have experienced foster care, and nearly all are at risk of going into care, experiencing trauma that many of us prefer not to think about. The COVID-19 pandemic has heightened those experiences and caused even more disruption in their lives. But what we know is that youth impacted by foster care can thrive. We see it every day at Friends of the Children. I'm pleased to introduce this rock star group of leaders today who've joined us for this important discussion. Starting with Io Atterberry. Io is a senior associate in the evidence-based practice group at the Annie E. Casey Foundation in Baltimore. Her portfolio includes supporting evidence building in programs and interventions that serve youth and young adults. Thank you for being with us today, Io. I've had the pleasure of working with Gary Clemens for 12 years. Gary's currently the executive director of Friends of the Children New York, and Gary has held multiple roles within Friends of the Children, including National Program Director and Friend, both in New York City and in Portland, Oregon. Tara Perry is the CEO of National Court-Appointed Special Advocates Guardian Ad Litem Association for Children, better known as CASA, whose national network has grown to include 950 programs in 49 states. For nearly 7 years, Tara has guided National CASA, headquartered in Seattle, with the goal of providing a volunteer advocate for every child that needs one. David Shapiro is the CEO of Mentor, the National Mentoring Partnership. Under his leadership, David has elevated and expanded the youth mentoring field across the country through his expertise, advocacy, and recruitment to achieve better outcomes for youth all across the country. Winnie Wexler has been the executive director of the Anthony and Jeanne Pritzker Family Foundation since 2012. In 2014, the foundation launched Pritzker Foster Care Initiative to highlight its commitment to supporting transition-age foster youth and the families that care for them. Marquise Williams is a salaried professional mentor, what we call a friend, in our Los Angeles chapter. He serves 8 youth and their parents, all of whom experienced foster care. Marquise is also an author of the book, Beating the System, My Life in Foster Care. I highly recommend this book. Marquise is an incredible advocate for youth impacted by foster care, driven by his own experiences. Thank you for sharing your unique perspective with us today, Marquise. I'm also pleased that Erin Kelly-Seal, the Chief Officer of Expansion and Policy for Friends of the Children, will be moderating this discussion today. Erin is an attorney, and she has spent her career serving as a child welfare leader, advocate, and expert under 3 administrations for the state of Oregon. And now I'd like to turn it over to Erin to kick us off.
Morning, everyone. I am so pleased to be here today with this exceptional group of leaders, and we are thrilled that so many of you across the country were able to join us. Please do submit your questions in the chat function, and before we get to those, I do have some prepared questions for each of our panelists. We're just really excited to learn from their insights and expertise. So I'm going to start with Tara. The pandemic has shed light on the weaknesses of our social safety net, particularly in our child welfare system. What have been some of the most alarming developments from your perspective?
Thank you. First, I'd like to just thank the foster families that are caring for our children during this pandemic. I think that's really important. They care for them throughout the year, but I know that it's even more difficult now. And to answer your question, one of the first things was there was no coordinated preparedness or response protocol for child welfare. So it left all of us working in silos, and we were certainly all caught flat-footed, but I know that there have been other crises that we could have learned lessons from. And this one is difficult to prepare for sure, but I think that there's a lesson to be learned in us coordinating our efforts through times like this. And then another thing is we realized that many of the ways that we work to protect and support children were rendered ineffective. The professional eyes and ears we depend on to identify and report child abuse and neglect, and those that support these children were no longer seeing children. As a result, some families and children have gone without the necessary services and support that they need. And then the disruption in education, where we have children now homeschooling. We know many children don't have the resources that they need or the support that they need to learn in this environment. And many of the children are already academically vulnerable. So this too was a concern. And then we realized, I know at National CASA, we realized and other partners that some of our policies and practices that we believe to be important to protect privacy and provide the best advocacy for children and families ended up being barriers to us navigating through this crisis. So we had to make changes. And I believe that some of those changes will need to be permanent. And finally, I would say that if history is any guide, we know that child abuse, neglect, and domestic violence are more prevalent in these environments when people are isolated, along with the stress of unemployment, financial insecurities, a lack of resources, and any type of outside support. And this is challenging for families that had some level of stability prior to COVID-19. So we can imagine the impact on families that were already fragile. We'll need to anticipate and prepare for the aftermath for families and children. And it's not a question of if something like this might happen again, it's when it will happen again. So being prepared will be critically important. Thank you.
Thank you, Tara. I really appreciate those insights. Marquise, your experience in care, you have been so brave to share with the world. You had an experience where you've had more than 10 different foster homes, attended more than a dozen schools. I'm just wondering, as someone who had that experience, how you think COVID-19 and the public health requirements around staying home to stay safe are impacting youth in care right now, and what you think youth in care would be wanting all of us to pay attention to.
Yeah, thinking back on my own experience in foster care, I really felt vulnerable, uncomfortable, and at times, trapped in the environments that I was placed in. Especially being someone that changed placements very frequently and was also at the same time separated from my siblings. There was always a constant feeling of isolation. But to cope with those feelings, I, relied a lot on schools, social workers, therapists, just overall consistent individuals to bring some type of normalcy in my life and serve as a distraction from those challenges. I think now more than ever, the importance of staying connected, consistency, and access to those support outlets are critical, for the safety and well-being of foster children. Again, using my own experience, when I think back on being in care, one of the things that I looked forward to the most was my physical weekly visitations with my families and other supportive figures. And honestly, that's what kept me going and what kept me, from giving up in the circumstances, running away. And so I think it's important to also, keep an eye out on youth, because I know for me, I wouldn't just come out and ask for help or ask for support in coping with these challenges. And so I would want people to be thinking about, at all levels when making decisions, how can we ensure that the unique needs of foster youth are considered and addressing during the policies that are being implemented, especially in the context of distant learning, telehealth, and visitations. Also, are we continuing and maintaining reunification efforts during this time? And how can we close the technological divide or support with that exists right now? Not everyone has, access to technology and resources to stay connected to loved ones. I know for me, if I was experiencing the stay-at-home orders, I wouldn't be able to stay connected to my family in care. So how can we address this? And especially, during a time when relationships and staying connected is key in overcoming these challenges. Thank you.
Marquise, thank you so much. Io, I'd love you to respond to some of what Marquise said around, his comments with respect to how particularly all of us can keep an eye on youth in care, but also thinking about the systems themselves. And you have your eye on many of these systems across the country and many providers that are working in support of them. What's one thing that you think is responsive and one thing that's proactive that systems across the country should be prioritizing right now?
Yes, and thank you. So I want to say, to be responsive, I think currently the child welfare agencies are really trying to ensure that frontline staff, the caseworkers, have the proper professional protection equipment to help keep themselves, the children and families that they work with and serve safe, but also offering virtual services when available, like counseling, home visits. And as Marquise just pointed out, that's a difficult thing because sometimes those aren't options. So I think those are ways in which child welfare workers are trying to be, agencies are trying to be responsive. But to be proactive, thinking about how we focus on prevention on the front end to ensure that we're not putting kids in care for poverty issues. Now, the first thing, the one backdrop, as Tara pointed out, is that the pandemic has just really exacerbated the existing disparities that adversely impact people of color, specifically that have poor outcomes in all domains. But the data is also showing that people of color have the greatest economic hardship and more positive tests and greater rates of death as a result of COVID, which is going to have this trauma on top of trauma. But also, as Tara stated, about the lower reports of neglect and abuse, because the system, the first line of defense, is no longer an option because of stay-at-home orders. And matter of fact, in several states like Wisconsin, Oregon, and Pennsylvania, Illinois, they're already showing that their rates of reports are down by 20 to 70% just in March. So we know that on the other side, as we go back to like daily functioning, many of these families will emerge who are on the cusp or already like in the system will emerge with even more red flags for the child welfare system. But the plan has to be and should be aligning systems to prevent unnecessary screening and identifying families for care that are a result of poverty and helping to prevent placement where possible. So that means being able to differentiate between what is a poverty or basic need issue and what is maltreatment. So ideally, we want to see some sort of developing preventive practice model. And one thing that we've talked about at the foundation specifically is evidence-based case management. So what that is, it's a research-supported framework to working with families to understand the situation and make sure they have a voice, as Marquise was stating, making sure that you're responsive to the needs of the families and the young people. So it's not a child protection versus the family preservation. It's a combination of both at the same time. It helps serve as an anchor for family support, and it's a plan to reduce the risk factors of families and to increase and strengthen behavior change options and also protective factors. So case management practices can provide opportunities for authentic inclusion of families in decision making, which in turn increases the commitment to case planning and implementation. So such practices also foster stable relationships between caseworkers and families in a context in which additional program and services can be available to really serve families. So focusing on ensuring the appropriate services are available at an organizational level based on focus population needs is important. Supporting caseworkers in connecting families to appropriate service-based needs rather on their needs. And then, well, behind that really is that there has to be a strong assessment component of needs for families to help identify where their strengths are, where their challenges are. But then at the agency level, caseworkers and frontline staff have to have access to an array of services that has to be assessed to ensure that that's available so they can direct families in the right, connect families where they need to be to get the support they need. And thank you.
I know, thank you for pointing out the complexities, but also the opportunity in this moment. And Gary, Friends of the Children New York is working closely with families, working hard to keep families stable and children safe through your model. And I'm just wondering, from the perspective of a community partner that is working to empower families and prevent entry into care, what are some of the things you think at the community level we should be doing to support families right now so that they can be as stable and safe as possible during this really difficult time?
Yeah, I think one of the first things is maybe reframing the question is how do we help families thrive even in this difficult times. I think that will also kind of change where our North Star is. I think if we're always trying to keep people stable and safe, I think I think we said every time we set goals, you kind of fall short of goals. I think if you make the goal far enough, I think you can help families out. The first thing I think you should always ask the families. I think that one of the first things that we did, we really wanted to get assessment out and figure out what the families need and hear it from their voices and really let that be part of your intervention. And we saw that families, definitely food was a need, but a big part of it, and people have already mentioned this, is that social connection. I think when social distancing requires people to kind of be isolated, and you're talking about people that are already kind of isolated already, and now they're being isolated in their homes. And so really what the families have requested is this help in the sense of like this brainstorming of what they do with their children every day and how they support their kids. A lot of the families that we work with, are single parent households, and they might have multiple kids, and they're just trying to figure out how to manage each day and how to help kids, whether it be academically or enriching out activities, because they do want their kids to be engaged and be doing something, but a lot of them, maybe just don't have the activities to be able to do that. So a lot of our friends are doing that and helping the families daily, kind of figuring out what each day looks like. Another piece, is really trying to figure out what resources are out there and how to get access to those resources. There are a lot of, New York has really stepped up, and there's food pantries, but trying to figure out where those food pantries are and trying to figure out how to get the food. Again, like I said, if you have a single parent household and you have 3 or 4 kids, how do you even leave your home to go pick up the food while having, kids at multiple ages? And so really trying to figure out how to get the food to them is another piece of it as well. So I think the biggest thing is really like the social supports and really figuring out the organizations that already have had relationships with the families already, because I think it's hard to get relationships with people if they're isolated in their own home. So really trying to find the organizations that already have had relationships with the families, and then working with them to figure out how to get the basic needs, how to help the kids with academics or enriching activities. And another thing that we're figuring out, I think prior to this, we maybe work with just kids, and we maybe, I don't think intentionally, but maybe demonize the families and kind of said, the families are separate and we're just going to work with kids. But what COVID is forcing us to do, in order to get access to the kids, you have to go through the parents, and because you have to work through the technology. So it's forcing community organizations to kind of work with the parents as well, whereas before we can kind of separate our interventions, but now the intervention is connected because everybody's in one place. So I think we really have to think about how we kind of keep doing this in a sense of working with the families as well as the kids and kind of bring it together. I think that's another important piece of what the opportunity that COVID is kind of presenting to us, in a way the way we've done programming prior to this was really separate, and I think we need to maybe combine that now.
Truly, those are great insights, and it's a great segue, Winnie, to an area that you have a lot of experience with, which is around collaboration, especially cross-sector collaboration. And you've been part of several collaboratives that are working to transform the Los Angeles foster care system for the better. Kind of shifting back to that system perspective and thinking with foster youth in mind, how should we all be working differently as collaborators to drive innovation and advance meaningful change for youth in care right now?
Thank you so much. And I also just want to acknowledge Marquise and so many other voices that we've been hearing, thanks to organizations like Friends of the Children and others who have really been using this moment to convene and bring people together and lift up these important voices at this time. And I think for our foundation and others that we partner with, it's just a natural continuation of a lot of work that's been going on for years. I think we can acknowledge that as funders, we have a unique ability and role to convene and to bring people together. And as funders, our foundation certainly can only accomplish so much on its own. And we can accomplish so much more when we're working with others around a common cause. And we've seen this now really throughout our entire experience. And right now, at moments of crisis, it only brings home that if we really want to see system change, and we really want to see the things that we've been working so hard for so many years continue, and this moment in time not set us backward, the need to collaborate is just imperative. One or two examples of work that we've been engaged with that has clearly made a difference. One is with the LA collaborative of funders for foster care that together have helped with LA County create the Center for Strategic Partnerships, which brings together funders to help identify and then finance pilot programs or consultants so that the county can innovate or do a test program that can then lead to them to apply their own county funds for something that's initiated through private philanthropy. Our foundation, through a series of events, helped to identify how an app that could be developed for the county to use to help facilitate visitations and tie together court orders for visitation with actual visits that were then performed by social workers, and then see how that can then serve to improve reunification. We funded the first design of this app, and now the county has taken on the cost of funding its actual development. Likewise, California College Pathways, which has been organized and run by John Burton Advocates for Youth, has brought together many funders over many years to really help improve access and success for foster youth in college in the state of California. And we do that not just by the research that we're able to fund collectively and the funding that we provide, but the fact that John Burton Advocates for Youth has been so successful in leveraging our work to bring tens of millions of dollars of state funding to this issue, so that California has now really been able to not just have an impact on the foster youth here in our state, but then also to share what we're doing elsewhere in the country to really try to create a movement around ensuring that foster youth have access to higher education. So those are just two examples, but of course, there are many others, and really it's this idea of convening, bringing together funders, and then using our collective capacity to help leverage public sector funding and help implement good policy and practice at the county, state, and federal levels.
Those are really, really inspiring examples, Winnie. I just thank you all so much for your work, and it's really encouraging to hear about the ways that your work is being leveraged, not just in California, but and beyond. David, you're thinking a lot about what's happening at the national level right now at Mentor. We thank you for that. What immediate actions should Congress take to better support youth at risk of entering care or who already are in care, both through this extended period of challenge and into the future?
Yeah, well, thanks, Erin, for having me. And I definitely drew the short straw because there were, as every one of the folks on the panel spoke, I was like, I got to lift that up and give a hallelujah. I got to lift that up. And now I'm left trying to answer this question about Congress, which is the question no one wants to answer because they seem to be the most dysfunctional body in America. But I would echo a lot of the themes as I talk about Congress, and then I'll shift to talking about something I would enjoy talking about more, but which is that, we are just magnified in this moment, the things we have not done, the things we have not fixed, the vulnerable we have left even more vulnerable. So there's been a Foster Youth Mentoring Act for 10 years that was originally introduced by Senator Landrieu and now is in the House, co-sponsored by Karen Bass and Don Bacon, a Republican and a Democrat, Nebraska and California. This would invest money in the sort of private, public, nonprofit, systemic partnerships and evidence-based approaches to mentoring that Friends and CASA and Silver Linings and Best Kids and lots of others in the sort of mentoring for youth and care space use and would scale up and train up more people to create those kinds of partnerships between systems and nonprofits and create the kind of permanency that Marquise spoke about, so that we are reaching and leveraging the civic infrastructure to support young people who have to make way too many transitions and who have maybe not always had the most trusting and lasting relationships with adults, to deal with that and to give them some sense of strands to pull on consistently. So in this moment of instability and of everything from inconvenience from some to devastating, tragic instability for others, we look at all these things that are vulnerable and the things we have not acted upon. And I would say that something Congress should be acting upon is the Foster Youth Mentoring Act, because it would make an investment right now in greater stability for young people, and for the next unstable moment that is just an exacerbation of daily instability for many who are struggle literate every day, we would have that investment. We would have that civic infrastructure. Right now, we have a lot of shining stars. I think, Winnie highlighted a lot of the local examples of funders collaborating and public-private partnerships. But to scale them, we need policies and investments that allow them to spread so they are not one-offs. And we have a framework for doing so. So I would say to everybody, go to mentoring.org, hit advocate, and write to your congressperson about the Foster Youth Mentoring Act, because they are considering, in my most hopeful, some of this languishing legislation as they look at the CARES Acts and think about where they make investments in stimulus. And the child welfare community has had a big voice in that around the age of aging out and some other things. And I think this would be an added investment in relationship. I would just add, I think, that, you know, and I would sort of be remiss if I didn't add this in, you know, right now, is that we are often so focused on whether systems are broken or working as some sort of zero-sum game, which basically there is no referendum. Systems are working for some and not for others, and working in some places and not for others. But we often lose sight of the human beings within those systems, what it takes to navigate those systems, whether they're broken or working or somewhere in between. You cannot do anything in isolation as a human being. I mean, if ever we're realizing that, and right now we're commercializing that by selling cars and things, talking about relationships. But if ever there were a moment where maybe we will start to get to relationship-centric interventions, hopefully this is that moment, that there is no choice. You know, people say, some pop columnists will say, like, relationships don't, you know, programs don't scale, relationships are what are most important, as if there's something wrong with programmatic approaches to relationships. Many people don't, you know, aren't born with relationship privilege. They might be born with just the opposite. And we need to intervene to surround people with relationships, especially our most vulnerable young people. So I'm honored that Friends is doing that, and a lot of folks in the mentoring community are doing that, and are creating a consistent relationship for young people, no matter whether we're in a pandemic or not. For a lot of people, every day is a pandemic. And for a lot of young people, every day is a pandemic. And what we can do most for them while we're trying to make systems work for them is make sure they have a sense of purpose and belonging and a consistent person navigating with them, whether it's higher ed, whether it's job, whether it's mental health. That person doesn't need to be an expert. They need to be a consistent and trusted force with unconditional love.
Thank you, David. You all have shared a lot of great insights. I've been frantically taking notes to make sure I can follow up on a few things, but I'm sure you all have some things you'd like to share in reaction and response to what you've heard from one another. So I just want to open it up to that before we move to some of the questions from our audience.
I would just comment and say, give David a amen on some of his comments, particularly as it relates to, these are issues that we already knew about, and we have to get to a place where this population is no longer an afterthought. And I think Congress has done some things to provide funding to families. States around the country have been very sensitive to older youth and youth aging out of the system during this time and what happens in those cases, as well as youth that were on the path to reunification and what happened when courts closed, and I think what position did that leave them in. So I think us as partners in this work, just continuing to be mindful of the importance of keeping this population first, keeping them at the forefront. We know that there are those vulnerabilities that already exist, and when there are times like this, we need to run to them first to provide more stability for this particular population. So I just wanted to comment, follow up on what David shared.
I was just going to also add that whatever the numbers or the population has been in foster care until COVID, in the months to come and years to come, it's going to be different. There are going to be many more families and children in need. And this doesn't just apply to child welfare. This applies to mental health. This applies across so many sectors. In California, you know, we've had an ingrained homelessness issue for years. And the number of homeless is already increasing as we try to desperately place more homeless people in housing to avoid, you know, contagion. And so we have to appreciate that the world that we're evolving into is not just going to be a continuation of the world that we've been in. It's going to be, and I don't mean to bring everybody down because It can seem overwhelming, you know, if you focus on just the negative. But I just think we have to be realistic that this is going to be a larger population, and we're going to need more resources. And we see this already in the public schools. You know, we need more teachers, more support, and yet the reality is budgets are being cut, and that's going to happen in child welfare and across the board. So how do we both acknowledge that and try to be more effective and efficient? And there are ways to do that, as Tara said. There are ways that we can do things differently. And I don't want to jump ahead of the conversation, but there are solutions.
Yeah,
and I just want to echo, I want to just jump in and say, you know, there's so much richness here in all that you're talking about, but I do believe, as you were just saying, Winnie, that things are going to have to be different. And I think Gary also talked about how now the time is forcing people to do things differently and consider families in a way that they haven't been considered before. And I think that is going to be the lack of dollars that are going to be available is really going to force everyone to think about how they can do more with what they have, do more with less. It's really going to require everyone to do more with less. So coordination at state levels is important. Ideally, we would love to have leadership from the the federal level, but there's richness happening in different places. The collaboration between places will be very important. And by state places, I mean states. Really looking at finances and doing financial analysis to figure out where their dollars can be better utilized in terms of coordinating services. And we know what works. We have evidence of what works. We know that having a navigator, which you talked about in your program, David, a mentor you guys do at Friends of the Children, you have mentors for families, a guide, a navigator, or something that helps people go through it, has the relationship and champions. We know those kind of models work. We need to go to what works and use the resources we have to lift those things up.
Yeah, I would agree with you that sort of like the Winnie's point of reality is one we all need to look in the face. It's also a collective failing in terms of how vulnerable we've left people, which is why the numbers are so mounting, and that all of a sudden we would care about sheltering people because of a health issue, but never before because it was a human right. But, you know, I think that to sort of play the flip side, the 30-second manager of the optimistic side, and to play off of what Io said, I do think we can get smarter. I'm not sure it's about necessarily doing more with less, but I think when there are systems, only because I don't like to say we should do even less for systems that we're already not investing enough in, but I do think, and I see this in the volunteer workforce, as well as the paid workforce in youth development and child advocacy, the lack of coordination, to Gary's point, between dealing with the whole family unit. Right. The idea that somehow in the academic world there's a choice between academic and socio-emotional, when they are the same thing. You cannot learn without having stable relationships and a stable place to live and stable food. You know, if this gets us maybe to more of a whole person approach, it may not, but if it does, and to Marquise's point, if we start to look at policy through the end user and the most vulnerable, man, we could maybe do a lot more with less. I'm not sure we make policies as they relate to young people that are always young people centered. They're usually adult profession centered. And we're going to have to change the way we do policy because of the influx in numbers and the potential lessening resources. I still think we should be demanding resources and collaboration at the level that allow us to deliver on our covenant to young people. But this may give us that revolution, that revolutionary opportunity. I hope we'll keep fighting together for it.
I love it. I love it. Marquise, we have a question from the audience I'd love for you to respond to. They ask, how can we better channel your voice and the voice of other advocates and people with firsthand lived experience to ensure and convince the courts who are slowing down in cases that involve families being reunified or foster youth need to have connection? How can we convince the courts and leverage your voice to do things creatively, using technology, having connection in other ways so that cases are not completely stalled and move forward? When you think about your role as an advocate and the way you've leveraged your voice, I'm just wondering if you have tips for the rest of us or for other youth in care or people who are supporting them who may be on the call.
Yeah, thank you for the question. I think, it's important to rally behind local and national advocacy groups. They do exist. Um, you can join um, and participate and advocate for these changes, because I don't believe that they're just going to happen unless we advocate for them, given our own perspective. And kind of like what like David had mentioned, a lot of these policies that come out are not really youth centered or have youth in voice. So organizing and collaborating with different organizations and advocacy groups, I think, would be critical in addressing and moving this agenda forward.
I appreciate that. Tara, you work a lot with the courts. You may have some reflections on that as well. And there's also a question around domestic violence cases specifically. In your response, you cited just the challenge that we know that historically cases involving domestic violence and child abuse go up during crises like this. There's a question around how courts are handling those cases right now during COVID and how youth are being supported as a result.
Okay, thank you. So just to follow up on one thing that Marquise said, and also to answer the question, we have been seeing some pretty incredible things happening with the use of technology with courts and court hearings. We've seen an increase in families participating in court hearings because now they can do it virtually. They don't have to take off of a job or drive all the way across town to go to a hearing that's going to last 15 minutes or so. And we're seeing unique ways that advocates are continuing to connect with children and connect with families. And I think Gary talked about the need to work through and work with the families. We're seeing how important that is now. So technology and some of the practices that we have transitioned to, I hope that they will be long-term practices, because we're seeing some really positive results. And to the question, we have seen around the country a decline in reported cases of abuse or suspected abuse and neglect. And we don't believe that's because it's not happening. We believe that it's difficult when you are in an isolated situation with the abuser, that it's hard to make those calls to hotlines. And then, as I talked about earlier, you don't have the same professional mandatory reporters, teachers, healthcare workers, social workers that are having eyes on children and families to identify what's happening in the household. We have been encouraging ordinary citizens. We all have a responsibility in this to keep an eye out on those families that your neighbors that might be struggling, might be having a difficult time through this crisis, more difficult than we all are. Keep an eye on those families and offer support in any way that you can. And then a comment that was made earlier, when we engage the public, I think in the future we need an educational agenda, public education, to identify what neglect really is. And poverty is not neglect. And many times poverty is deemed neglect and reported, and there are many families that operate in these environments. And to Winnie's point, we're going to have more insecurities as we move out of this place with the unemployment rate, et cetera. So we expect that there are more cases of domestic violence, abuse, and neglect that we are not seeing, that we will see after we get back to some place where things are more opened up. Courts are starting to open back up now, and they're starting to use technology to have hearings. all of the same systems that are available to report any domestic violence or neglect or abuse. Those systems are still there. And so we have to encourage families and children to tap into those systems, because it's not like there's nobody that's going to come to your rescue and nobody that's going to address that, because all of those systems are still operating, and they're just doing it in a different way and trying to be more creative.
I'm hearing a couple of things. Thank you, Marquise. Your point, I think, is really well taken around all of us having the opportunity to lean in with groups that support youth in care, to have a stronger voice and that are really organized, because those groups can provide pressure in an organized fashion around policymakers and elected officials, including the courts. And Tara, I'm hearing you encourage all of us to really pay close attention. And if we are thinking that we have an instinct around someone that we know may be experiencing domestic violence or feeling that sense of isolation, a young person, and they may not have safety around them, to just identify ways to stay in touch, to be in relationship. David, you mentioned this as well, to create an opportunity perhaps for a conversation or a subtle word that might say, I'm not feeling safe right now, so that we can go ahead and report and activate the systems that are designed to protect. And I love the conversation about the difference between neglect and poverty. And Gary, there's a question that has come in around the challenge that the public has right now, in some cases, supporting families who are in need or struggling or who are in poverty. And the narrative, Tara, you mentioned a public education campaign. This person is asking, how do we change the narrative? How do we help frame issues that will, so that we can drive support for families and supporting organizations that are actually helping and empowering families, as opposed to a narrative that says that that support or help isn't deserved or isn't needed? What are your thoughts about that?
Yeah, I think realizing, we have the child welfare system that's been created to keep kids safe. And all in all, in a way, I know David touched on it, that system is working and is built to kind of keep kids safe, and that's their main focus. I think what we need to also start creating is other systems or other structures that are here to help people thrive and are kind of looking at it through a different lens and have a different goal in mind. ACS or child welfare's goal is always going to be keeping kids safe. Friends of the Children's goal is to help kids thrive. And so we approach the work in a very different way. And we look through it through a very different lens. And so I really do think, I think it's hard to change, especially when something's been in place for, decades. I think it's hard to maybe shift that. But I think if you create new things, and those new things kind of have a new lens, a new outlook on the families that we work with, I think their approach is going to be much, much different. So I think really looking for programs that kind of are culturally informed, are really aware of what the families are going with, or using the families and kids' voices to part of the intervention, kind of what I mentioned earlier. I think you're going to get a very different outcome on that. And so I think when you invest in those other structures, and those other structures have the kind of same backing as the child welfare system, then I think that's when you kind of change the dynamic on that. But right now, it's kind of just it's off. Child welfare system has our government backing and the funding behind that, and you have programs like a Friends of the Children that are not equally as funded, but so our voice isn't as loud when you're talking about issues of inequity. And so I think when you start shifting that, and like I said, those programs are funded, then you kind of can change the narrative around that. Because so that's my take on it. Rather than trying to always go, I think a lot of times we try to go to the system and change the system. And it's, David hit on it. A lot of the systems they're doing what they're exactly supposed to do. So I don't think we should necessarily need to necessarily change the system, but I think we need to build up other systems around that kind of counter what's going on, and kind of systems that are anti-racist or whatever you want to, or creating different outlook on things.
I think, can I add to what Gary said, Erin?
Of course.
But I know there are also, like, reading the chat box, this should be a 9-part series. People are asking the most unbelievable questions in the world. I'm not sure. I can't speak for the others, but I'm not sure I have the answers. But the questions are unbelievable. I would only say, like, I would only add on to what Gary said, that we seemingly have these two frames in a broad-based way, not speaking for our individual perspectives, but either it's like, here's what individuals deserve, or here's how we prevent bad things from happening.
Right.
And we all know which groups of people fit into those two buckets. And I think until we reframe around, here's what everybody deserves, here's the basic human rights of everybody to thrive and strive, and any failing to provide that is a failing of the nation. It's not a failing of the individual. Until we get there, we're screwed, because we're going to continue, especially when resources get constrained, to get into the current discussion, which is about who deserves what and why you should fear that that guy's getting his and you're not. I mean, this is obviously as old as human nature, that, you know, blaming somebody else is a really powerful elixir. But we tend to sleep at night in a capitalistic society believing that some people deserve what they got and some people didn't. And until we reframe that everybody needs these 8 things, whether it's healthcare, whether it's housing, whether it's mental health, quality school, and work to fulfill on those 8 things, instead of preventing bad things or saving money or making money, all of those things will come. The society will run better if everybody has these 8 things. I just think we're in a negative, who gets what, kind of divvy up a small pie, big for a couple. And so we have to shift our conversation to, like, you know, when someone's talking about who's getting what or who deserves what or how to prevent this bad thing from happening, as Gary said, some systems have to do that. That's their responsibility. The rest of us have to be saying, what are the 6 things that every person needs? And how are they being provided? And I don't want to have any other conversation, because the rest is just like blaming people for problems that are of the nation's making and not their own flaws, you know? So,
David, you know, I would say a simple way that I look at things is that if we start to treat all children as though they were our own children, if I want the same thing for children that are in care that I want for my own son, I think that's a start. And I'll just say one quick thing about what Gary said about the child welfare system and this juxtaposition, because they are there to protect children, and sometimes that can be in conflict with preserving families and strengthening families and that family unit. So I think you make a really good point about other sources or entities or structures with the sole focus on strong families, helping families to thrive. We know if we have strong families and they have the resources that they need, they can care for their children, and children in those environments can thrive.
And I want to just, because I saw a question, this is about are there any efforts underway to address disparities in the chat box? And I want to post like everything that everyone said. I want to say that when you talk about class and race, which is at the bottom of everything, on the back end of everything we're talking about in this country, when there have been efforts to do with the first thing is education about the way this system advantages some people and disadvantages other individuals. And the conversation is around how we have empathy for one another and how we have to think about everyone as deserving. That's one thing. But at the front end really is about having a conversation about the history to help people understand that it's not, none of us here, it's our fault that we're in the situation we have, but what can we do about it in this space? And also back to the part I made about the evidence-based case management is a piece in there about having closely competent programming available, individuals in the front line who understand, who are trained to understand about some of the socioeconomic issues that individuals face to help better direct them and provide them services that could help them be successful. But it does have a cultural competence to it to help deal with the bias that people may bring to the table knowingly or unknowingly.
I really, I agree with David. Or maybe it was Tara who said we need a 9-part series for this. The questions that we've gotten are great. We only have 5 minutes left, and we really wanted to end giving the panelists a chance to to really share with us briefly. It's going to have to be brief. I'm sorry. You know, only in crisis, actual or perceived, can real change happen. There are times where that is really our truth and our reality. And I'm wondering, as you think about a reimagining of the foster care system, which many of you and many of us have been working toward for many years, what does the crisis right now allow us to think about as we go forward? What should we be focused on in terms of a call to action and some steps that we can take together to make the system better on the go forward? Winnie, why don't you kick us off?
I feel it's echoing a lot of what's been said in terms of reinforcing our focus on prevention as much as we focus as a nation on supporting children and families who have been separated. We need to invest more to reduce those incidents from occurring, and that can be done by the things that Gary and others were saying relating to providing supports to families, the Family First Act. There were a few questions in the chat box about that. Its goal is to help shift or add actually more money to prevention so that there are fewer removals from the home, and you know that's going in the right direction. The question that was asked about what's the messaging that could be changed to help change the whole narrative, something that Casey Family Programs has been helping to arrange over the last year or two, is bringing people in the field together around this question of primary prevention and what can we be doing to really create a message so that everybody in this country shares ownership and responsibility for our children. And that could be something like a PSA campaign, similar to what was done 60 years ago for forest fires, where all of us grew up knowing only we can prevent forest fires. Why shouldn't all of us say only we can prevent domestic violence, children from being suffering from harm and neglect? I mean, we can all share that responsibility. It's not just for people professionally or for those who have volunteered to be mentors. It's for every single person in our society. And if that's a message that we can own and start to deliver, that can really change the whole mindset of the country, which is kind of what has to happen, particularly now at this moment where we're all agreeing there are so many more people who are going to be not just in child welfare, but basically in need of support on multiple levels. And I'll just add one more point about technology, because this has been a focus for our foundation for the 8 years that I've been there. This is the moment where finally the wind is behind our sails on this, and there's just no reason not to do it. And it's beyond just, of course, every child in school needs to have a laptop to go to school from home, but it goes without saying. But every system-involved family needs to have a laptop or a computer or a tablet or something that connects to the internet. Because as we've all said, between telehealth, telemental health, visitation, court dates, applying for unemployment and other SNAP and other funding services, you need to have access. You can't exist. And this concept of the digital divide, which was a term that was developed in 1995, that's antiquated. The issue now of having access is no different from what we say here, indoor plumbing. We don't talk about, oh, people need indoor plumbing. Everybody has indoor plumbing. That's where technology is today.
Thank you, Winnie. I am going to have to turn it over to Terri. I want to honor the fact that this was a 1-hour webinar. It's 9:59. Terri, will you close? Well, I just want to thank the panelists for your amazing insights. Terri, would you close us out?
Sure. Thank you all so much. I want to just close with a story of hope. And it's about one of our 8-year-olds who, right as the pandemic hit, was going into foster care. His friend's still able to connect with him, but it's through a landline because the caregiver isn't familiar with technology. But before the pandemic hit, the friend had seen his Spark, Tommy's Spark, in guitar when they'd gone to visit a guitar shop, and found a donated guitar for Tommy. And as this pandemic hit and there were just phone calls going on, Tommy taught himself to play the guitar, this little 8-year-old, and he wrote a song called Hope Will Come, and he played that for his friend. And anyway, it just warms my heart, and I think we all believe what Tommy wrote, that hope will come. So thank you all for joining us today.